an adaptive strategic planning process. And this is our fourth of a Zooming Out speaker series, our fourth session. So if you've been with us before, welcome back. If this is your first time, welcome. We want to be really intentional throughout this process to hear different voices, different perspectives, to have a deeper, more meaningful engagement with our partners, our internal staff and networks, external partners, new partners. We know that it takes all of us to really create the vision and the world that we all seek to achieve and really, prevent child abuse America. For 50 years, we have been really trying to assure the conditions in which families can thrive and children can be safe and healthy and reach their maximum health and life potential. But we are committed to being really intentional and humbled by these conversations to even figure out together what our North Star needs to be in the next 50 years of this work. And we need all of you, all of your voices, parent leaders, community members, other partners, welcome. And, we are very thoughtful and intentional, again, of being inclusive of different perspectives, different ideas, and having race equity at the core of everything we do across our different pillars, across our different activities. So today we're in for a treat as, again, the last session of this calendar year will focus on addressing systemic racism and equity, poverty, at the program level. So we've kind of gone lots of places, and here today, this is what we're going to be talking about the next little while. So with that, again, so happy that you're here. And I would love to introduce my colleague, Catherine Murphy, PCA's wonderful research manager, and all things that Catherine does to really moderate this session and to, of course, introduce our speakers. Catherine, the floor is yours.
Thank you, Melissa, and welcome all to our fourth Zooming Out series event. We are so grateful for your continued engagement. As Melissa mentioned, I'm Catherine Murphy, Research Manager at PCA America. And today our panelists are Eddie Brown, Claudia Peralta-Mudd, and Chastity Lord. They will be discussing, they will discuss addressing systematic racism and poverty at the program level. And this will be followed by a facilitated discussion and audience Q&A. Edward Brown III was recently appointed as Director of Operations at Hartford Communities That Care. With over a decade of experience and the last 6 years serving as Program Director, Eddie has coordinated critical programs and services by identifying, developing, and implementing evidence-based practices with youth and families for high rates of success. Specializing in leadership development, community engagement, and public administration, Eddie uses that experience to promote education, healthy lifestyles, and practices that create effective partnerships with key members of the community. Claudia Peralta-Mudd currently serves as the Program Engagement Manager at the Center for Health Equity at the Louisville Department of Public Health and Wellness. Her professional experience includes language services, cultural competency, as well as leading the diversity efforts for the city. She has been recognized as a 50 People to Watch by Louisville Magazine, 25 Most Influential Latinos in Louisville, and was a recipient of the Jewish Family Vocational Services Multicultural Opportunities for Success and Achievement in Our Community Award. This award honors immigrants and refugees who have made a significant contribution in their profession and in the local community. She has served on several boards and committees from education, social services, and health. Chastity Lord, President and CEO of the Jeremiah Program, has spent 2 decades dedicated to dismantling systems of inequity for marginalized communities. She deeply believes that generational poverty is a social justice issue and that families are the best owners and narrators of their lives. History has proven time and again that building infrastructure, leadership, and power for marginalized communities creates a contagion of long-term change. Chastity's professional North Star and commitment to equity and justice for the past 2 decades is influenced by her own personal experience as a first-generation college graduate. She is a 2012 Pahara Aspen Fellow with the Aspen Global Leadership Network She serves on the board of the Shriver National Center of Poverty Law, and in the past year was quoted as a thought leader in top-tier outlets, including Reuters, Politico, CNN, MSNBC, the Boston Globe, the New York Times, CBS Morning, and NPR. We are delighted that they are here today to share their work, and I'll pass it to Eddie to begin.
Thank you so much, Catherine, and thank you everyone for the invite, and I'm honored to be here to just share around this amazing issue. Interesting topic, addressing systemic racism on the poverty level and in the program level. Eddie Brown, again, from Hartford Communities That Care, native, born and raised in Hartford. Just really came from the statistical approach of being labeled as that single kid from a parent household, and very much where a lot of teachers and things said that I wouldn't amount to anything. But fast forwarding, I'm just happy that I was able to beat the odds and really come back to give back to my community, leaving undergrad and grad school on the corporate level. It really wasn't my forte, but really understanding the environment and the socioeconomic background that I've come from, being able to come back full circle and help the kids and be the person that I needed when I was younger. So I do work for an agency in Hartford Communities That Care in Hartford, Connecticut. We're a community-based organization that was founded back in 1998. Our mission is pretty much to create a thriving, nonviolent, drug-free environment for youth and families. Really, HCTC identifies, develops, implements culturally appropriate, high-quality, evidence-based crisis response, mental health support programs, partnerships and policies to improve lives of youth, adult victims, and crimes and their families. Before I actually get into the Youth Leadership Academy that I've been coordinating since 2016, I'll talk about our additional programs briefly. One was founded in 2004, our Hartford Care Response Team. Our agency partnered with St. Francis Hospital and Medical Center here in Hartford to form what is now a hospital-based violence intervention program. Intervening and providing care for well over about 1,800 victims of violence in their families since that time. Really being on call 24/7. They're up and moving, leaving the safety of their homes and their families to really make their ways to those hospitals. The team of providers really are hands-on in the community to really support those families and victims that have been impacted by gun violence. So really this program has been ongoing and repeated over and over again. And last year, we served about 210 victims and their families, visiting hospitals and crime scenes over about 74 times, and let alone the second half of the year. So it's been very, very intense. More recently, last year, Connecticut took the lead in the role of professionalizing frontline violence prevention workers, right? So there was a bill that was passed last year by Governor Lamont, where it was making Connecticut the first in the nation to implement guidance from the Biden administration to use Medicaid as a tool to support community gun violence reduction. So this bill is really making those violence prevention professionals who've been on the job longer than 6 months, who have completed a real intense training through our national partners, which is called the HAVI, abbreviated for Health Alliance for Violence Intervention. It makes them eligible now to have their services reimbursed under Medicaid. So, putting in the work through our hospital violence intervention programs, along with our Hartford Care Response Team, I will now move on to really the root and what has been forming over the last 2 decades with mentoring and support, which is our Youth Leadership Academy. This is where our youth leaders are mentored and supported not only by me, but just a generational capacity over the years with our agency and its founding. This original concept of youth leadership development was really why the agency Hartford Communities That Care was founded. So before the care response team, before the hospital violence intervention programs, it was around youth leadership development. And when we talk about addressing systemic racism and poverty on the program level, I think this is one of the solutions when it comes to community engagement. Since 2017, when it was resurrected, these youth have been just advocating for different policies and recommendations that they see, different problems in the community, building new partnerships to prepare for our annual summits that we've hosted since 2018, also extending the reach beyond and supporting the kids after they graduate from high school. And then I'll get into more of that in a few. But more importantly, it's really from their lived experiences, living in Hartford, living in the greater Hartford area, being around gun violence, being around poverty, being around poor educational systems, just coming together and advocating to create those policy shifts where they can share their voice in those political platforms that we have here, at least within our state and around the country. They've been around to different summits. We've been to Boston, we've been to Washington, D.C. at the U.S. Library of Congress, an amazing relationship we have with Congressman Larson here in our legislative assembly. They've been on virtual summits as we had to change and shift to the virtual capacity over the 2020 pandemic. And we've had a partnership with St. Francis and Trinity Health in New England's Child Safety Forward team, where we changed the trajectory around one of the topics adding on child injury and prevention. So it's been a lot of topics around that. And this is one of the reasons why I was able to network and tie in with PCAA and be invited to share the stuff that we do at HCTC. So, you know, just really allowing our youth to get the exposure that they need. We have year-round cohorts. There are a lot of times where you see summer programs for youth, or you see occasional things that they have at their school, extracurricular activities. However, this is a year-round program. We meet weekly on Saturdays from 10 to 2, and these youth come together, not only just doing research and public policy recommendations, however, they are learning life skills. We're bringing in different folks to come and do workshops around life skill-based stuff, college readiness, career workforce readiness development, and different things that they need that they may not be learning in the public school system. Briefly, this is just some stats on graduation rates and what is happening beyond the middle and high school realm, which is our new initiative that is launching early spring of next year, which is the Futures Beyond High School. We have now some of our founding members of the Academy are now on the collegiate level or doing entrepreneurial efforts and other supports beyond high school, whether it's trade, certification. And now they're taking the leadership and development that they've learned in our program on the collegiate level to build those networks and then come back and be mentors for our current participants. From our annual summits, we've had in person at Capital Community College here in Connecticut, all the way to adjusting to the virtual platforms, being able to have Connecticut legislature, different community advocates and supports to be keynote speakers. And this is where we look at the broader approach. Outside of just our 15 to 20 youth that we have in our academy, we look at citywide and school-based youth around Hartford and the greater Hartford region to come together as a whole, hearing other perspectives, hearing other youth recommendations and public policy. And they break out into work groups and they have keynote speakers, and they just come together as a summit and a conference to really advocate on addressing issues around education in the new normal, preventing child safety, community organizing, so many different topics that they've studied over the cohort of time. Lastly, I will share one of the slides here, excuse me. I wanted to just briefly share around a topic that we will face today. So, just looking at the questions and that are really on the topic of the panel. And when we looking at addressing systemic racism and poverty at the program level, for me, the key to changing these efforts are, what we're in the middle of right now, specifically if it's not our agency or just around the country, preventing violence. And I think that's really to do this comprehensively, right? It has to be done to cut across all of these specific inequities. Most of these topics have been shared with our youth, talking about, unemployment, housing, education and the new normal during COVID, education and the chronic absenteeism, violence and trauma when it comes to mental health and different disparities. These all tie in together, right? And they can't really be handled in like a one-piece meal at a time, but these are all related. And I'm looking forward and really looking forward to educate myself on the different perspectives that I hear from other programs around the country and the two speakers that are here today to really talk about the paradigm shifts that they see in their own communities. So that's pretty much what I wanted to share in a gist. I can go on and on in regards to these topics or go on and on more in depth about the program, but with respect of time. And again, this is just connecting with us, and I can send this over to the respective person to get to continue to follow our program and get the links and learn more about what we do. Thank you.
Thank you, Eddie. And next I'll invite Claudia to share her work.
Okay, good afternoon, everybody. I am Claudia Peralta-Mudd. I am the Community Engagement Manager for the Health Department at Louisville, Kentucky. This is a city of around 1 million people. Very interesting because the last 15, 20 years, the population, as in many other cities in the nation, has changed dramatically in numbers on the influx that we have from mainly refugees. We have right now, 3 agencies that deal with refugees, and that is a big influx within our population. So my particular job started basically this year. It was an initiative that the health department started it mainly because they decided that, or they realized that after COVID hit it, there were a lot of people did not get the information that they need to thrive within a pandemic. Within that particular community, obviously people were segregated mainly because they did not speak the language. Maybe they didn't have access to internet. Maybe they didn't have the support needed for a community to thrive, especially when you're maybe new in the community, certainly vulnerable people in the poverty and so forth. So the health department started thinking about what we could do just to make sure that everybody gets the information they need just to be a successful community. So with that in mind, they decided to kind of create a couple positions. One of the positions is mine. So my main position basically calls community engagement, and is that basically it. I go into the communities. I basically, in my position, I talk basically with leaders and organizations in which we try to figure out what is the best way for us, health department, to engage with people, to number one, trust us. Coming from government, as you probably, I don't know exactly what all the people is here today represent, but if you work in government and you have some sort of relationship with government, you might know that sometimes when we talk with the communities, and if you come from government, they don't trust us much. So we have to start very, very little, very small steps, trying to figure out why or how we're gonna do this, how we're gonna first make sure that they are opening their life in a way just to let us get in and try to help somehow in whatever situation might happen. We have an amazing array of programming in which most of the time, a lot of the community doesn't use them just because they don't know it, or they don't know how to reach us and so forth. And also we come most of the time with and this is something that came from data in a survey that we did a few months ago. Sometimes the community see us like we imposing things on them. So in my perspective, I'm trying to do both things, trying to engage the community in a way that is friendly enough for them to realize, hey, we can trust you and the organization you represent. So in that way, again, my position is quite new. I also have within my team what we call a CHW, a community health worker, and we are developing a really nice support group through that. That's the CHW support group that actually we have is a group of CHWs within the state, although we do focus in our county, which is the largest county probably in population. But we do a support system in which the group really is coordinated by one of the persons in my team, and they might have questions about resources and services, maybe in different languages and so forth, in different part of the state, and we will be able to answer or send out the information or just ask somebody else about what is out there, what the resources out there, and how we can serve the community better. So again, we're trying to figure out what is the best way to communicate with people, and on the other side, what the community might need. On that relationship too, we are basically going and trying to create the spaces in which community can come and talk to us. We can offer the kind of, we don't call it focus groups yet, but basically we're trying to open the opportunity as such a focus group in which people can come and talk about maybe something that, you know, kind of is interesting for the community, or the community might need that I probably don't see it, or somebody in the health department doesn't see it. So with that in mind too, we are creating what we call the Community Advisory Board. That would be a representation of people from the different part of the community, in which they will advise us on what the community might need or what the community might want to see happen from the health department in this case. So this is still in progress. Probably, as many of you know, we have a shortage of talent around us. So it has been a huge challenge to just to hire somebody for that position. And that position is vital because that will be, with my support, will be going into the community trying to hire, and we hire those people. They're paid positions in a way. And they will need to be that, you know, the liaisons between us and the community, just to bring up some sort of opening conversation to figure out, hey, how we can do better next time we might have an issue like COVID. We did at the beginning, for example, with COVID, which that was previous my time here, we have a lot of services provided for the community that were untouched because the community did not know how to access those. So this time around, having all this other support around the services that we provide, we thought this probably would be the best way just to communicate with the community to make sure that they help us to send out the information that they might need. So that's the overall kind of work that we do right now. Again, is quite new on our side. My expertise in many ways is working with immigrants. That's the experience that I have for many years. So certainly one of the main aspects that I look all the time to is cultural competency, what we call now diversity, equity, and inclusion. So I'm always mindful, very mindful that within the department and also within the community, we are aware of that and we listen and include everybody in the conversation. That is my main focus too. So I always look for a big representation of the different people that we have in the community. One of the things at one point we were missing, I guess, the boat was our government looks really kind of, you know, not representative of the community. So my point early on was, hey, if we have a community that is represented by X and X amount of people, different people, we have to have the same mirror within the government. So how we can do that? How we, if not, we really do not represent the community that we serve. So thinking about including people, that is also one of the things I do through my position, how we can help government just to be representative of the people that we serve. So that again, is in everything that I'm mentioning right now is in progress because again, my position is quite new. So that is the overall things that we do through CHE, which is the Center for Health Equity within the health department.
Thank you, Claudia. And just to a little announcement, Chastity had something come up and may not be able to join us. So if she joins us, I will pause and have her share her work. But for now, I'd like to begin with a few facilitated questions for Eddie and Claudia.
Okay.
How does prevention programming need to be designed and implemented differently to better address systemic racism and poverty at an individual level and in ways that change context at a systems level?
That was a long question.
I can put it in the chat too.
Yeah, that would be great.
Sure. And I can repeat it. So how does prevention programming need to be designed and implemented differently to better address systemic racism and poverty at an individual level and in ways that change context at a systems level?
Well, I would say, number one, every time we talk about preventing, I guess we have to listen. Listening for me would be a thing that sometimes, especially again, remember that I talk from the government perspective. In government, sometimes we have the idea that we know it all. So we will tell you what you have to do just to thrive in the community. So, and I think when we talk about preventing, we go into that very easily. So I think it's just listening to what is out there. That for me is vital to have this community advisory board that will help us to figure out. I mean, I might know some communities, what is might be the issues and so on. So how we can help them on that. But listening, opening the door to them, I use the word access quite a bit, Because I think when you provide access to the communities, the access could look in many, many different ways, but I think access really comprehend exactly what is in my mind about giving people the opportunity just to have a little conversation with us, just to create maybe some sort of programming that will prevent whatever it might be. So to me, that is what it boils down to it.
I agree. Just to ditto off what she said, honestly, we just got to pay attention to how these interlocking inequities really interact and just deal with them. You know, you're talking about jobs, you're talking about housing, you're talking about education, mental health. I mean, it's a laundry list of things that really reinforce the cycle of poverty. So at the end of the day, how are we dealing with them? You know, with programs, supports, services, education. How are we engaging our people? How are we engaging the community to really deal with these issues one step at a time, and also charging and holding our policymakers accountable as well too. But as a whole, you know, what specific supports in our programs are, you know, doing justice and doing our due diligence to really eradicate this cycle of poverty. So that's what I would say.
Absolutely. I also would like to kind of add, in my particular case right now, we are within the transition mode because we just have elections last month. And so the new local government is coming in January. So everybody is kind of excited in a way to figure out what the new administration will bring to the table. But from my hopefully from my position, what I'm trying to push is more education for the community, in which, you know, how we can really help the community just to be preventing things. So with more education will be, I think, will be certainly a way that we can help through local government. And I'm not talking about the formal education basically for children. I'm talking about education that is a little different than the one that they get in the elementary, middle school, and high school. Maybe education for adults, how to reach the system, how, you know, you can help your neighbors and so forth. So I think with this new administration, I'm really hopeful that maybe we can implement some education programming in which we can help the community just to thrive better.
Great, thank you so much. Moving on, what paradigm shifts need to occur in programs and among funders and policymakers to support these changes?
This comes to really building these building partnerships, you know, the interconnection to really enhance, share, maximize that capacity across the entire systemic landscape. Honestly, when it comes down to community violence prevention, for example, you know, well-coordinated collaboration between, you know, the public, private, nonprofit sectors. When you talk about resources, right? Those are the resources, and then you know, charge and exercise the authorities when it comes down to the federal government, when it comes down to the state, municipal government, right? Those are where we're creating the funds, we're creating, evaluating programs, and then coming to serve as providers, right, at that community level. So the resources, the authorities, and the providers really have to intersect and talk to each other. It's all about communication, but those multidisciplinary partnerships that really enhance and maximize that capacity across the whole approach of the landscape of this issue.
Well, I would say absolutely agree with that, just to have a fluid communication within policymakers and funders and so forth. What are the things we see now, especially because the transition that I was talking about, a lot of people has a lot to say in a way. So I'm very looking in to see if whatever we're trying to do, everybody agrees on what is going to be the thing that we need to move forward, because a lot of people might have ideas, but we need to kind of agree in some ideas that are concrete, practical, that we can put and move forward. And that's, to me, in a community like ours that is not super big, that's the main thing. So obviously with policymakers, that is vital. Right now, for example, we did have, this is my second time working in local government. I worked in the 2000s and I left after to work with refugees purely. And I'm back now. And one of the things that years ago was language access. And we have resolutions and policies around it. And for some reason, it went away. So now, a few months ago, we have a new resolution going on with language access, and it's there, it's right there, but it is doing really nothing. So now the thing is that moving that policy in which will be effective for the community, because it won't make any difference if we have a resolution in our case and it's not moving forward just to implement it in a way. So what we're gonna do just to implement that, and that is the conversation right now. So we need to get agreed on what is going to be doing that particular resolution, how we're going to implement that, how it's going to help the community, who is going to do what and when. So I think, to me, that is vital, just to get in communication in which we will agree on what we're going to move forward and how we're going to do that.
Absolutely.
Thank you. And Eddie, I liked kind of your comment on resources authority. I would maybe update it to decision makers and providers. I think often kind of in this space, or at least I often talk, it's kind of either researchers, policymakers, practitioners, but kind of highlighting that decision maker piece and kind of remembering how all those pieces come together is critical in this work.
Absolutely. Yeah. I mean, as providers, we are decision makers. So once that comes from those authorities to provide those resources, then, hey, we're here at the program level, as Claudia said. It's not about just talking about what we're going to implement that may not work, but we have to talk about and hold them accountable on what we actually need, what's going to actually change. So as providers, yes, decision makers is perfect. So I love that.
And this is going to be another long / two-part question, so I'll also put it in the chat. What specific strengths do direct service providers in the prevention field need to optimize in order to deliver programming that is effective in addressing systemic racism at its roots? And what can current movements like the structural competency movement in health teach us about this topic? Start with that first.
I don't do direct services in a way myself, but through the CHW program, we don't do also direct services, but we provide support. So I guess when you talk about what is the strength on direct services, to me, it will boil down to answering the question that the community have. And that, to me, is the value of this particular group that we have, because the question is always clear, and it is how I can get it. So, and it's so big, it's within the state, so we can certainly provide that answer in one way or another. And the beauty of that, there is a representation from all the different organizations. It's not only government, excuse me, but there are a lot of providers there. And a lot of providers with different capacity and different kind of funds too. So we can get answered right away most of the times how to provide direct services. That, to me, is the strength of the direct services that we can provide through our, public health department. I will let Eddie go on that one, and maybe we can go to the other one later. I need to read it though.
Yeah.
But as far as for Hartford Communities That Care, I think it's essential that we, act as credible messengers to really increase that public support for these evidence-based improvements.
Sure.
For us, the experiencing the culturally conscious mentoring with our program, really applying research to the specific problems, conducting our summits, and engaging the community in these things, in these dialogues of see. And these youth have been delivering legislative testimonies, as well as some of our staff. So I think, as messengers, as people that are implementing these things out to the public for the improvement, I think that's where it stands to, where a lot of strengths, and, we can help the community in providing that as far as educating them on those specific things. And that's different ways to be effective. So those are a few examples that, we've been doing. So I just think it's really acting as that spokesperson, acting as that messenger to really increase that support for these improvements.
Yeah, and also providing or elevating the different pockets of the community. I think that for me is very important too. Just make sure that everybody is included in the conversation. So how I will elevate the people of the different communities within my city that are not represented. They are not at the table. And we, as a providers, I'm a social worker too. So we have this conversation for a long, long time about who will represent, who is at the table. Well, look around. Most of the time, the people that we want to serve are not at the table. So we need to make sure that that is contemplated and elevate those communities. If they are not here, well, we need to go and look for them.
Thank you. Kind of moving on to the next question. What are the most effective strategies for ensuring equitable access to effective programs, given the large context of poverty and systemic racism?
That's a difficult one.
Mm.
Effective strategies, in a way, all the time I feel like you are improving daily. Which one is the effective one? Which one is the one is going to work today that probably didn't work last year? Or not certainly what it worked before COVID is working today's day. In our case, even we battling a big trauma that we have. A few weeks ago, maybe 3 weeks ago, we have a big issue in the headquarters. So we cannot provide really much of the direct services because it got flooded. We have 3 floors in the building and we cannot get into the building anyhow. So if that was how we go effectively, we will certainly serve our community if we don't have even a building. In a way, hurt us because the clinics that they work there, they are not open. But it was in a way a good thing because now we need to figure out, hey, we need to change the strategy here. So where are we going to have the TB clinic? How are we going to tell people that this is not open and it's open suddenly in the south part of town? So the strategy for me is in the health department, it changes as we speak in a way. Also, one of the things that we always need to look into is, okay, the community, at least the immigrant community here, changed the part of the city constantly. So, and we have new refugees arriving all the time. So make sure that cultural speaking, we can address them properly. So, and also the language barrier, how we going to certainly make sure that they understand what we're providing if they don't speak English, or we don't know how cultural speaking can approach them. So in our case, certainly to make it equitably, make it accessible, make it, for everyone. It constantly is a reminder that we need to always kind of look into what is available there, how the community is changing, how we're going to address them. So that would be kind of how, in a way, we ensure that access. And that's the word, my favorite word, equity access. I love that.
So as soon as you mentioned the question, it brought me to a strategy for creating effective community change that we actually use in the agency. We actually use with our youth. I know Jennifer may be familiar with it from past presentations that the youth have done. And it's really 7 strategies that I'll briefly share. One is the providing information, really communication of the important data, meetings, forums, and public announcements, community meetings specifically. The second is really enhancing skills, like activities designed to increase the skills, training, technical assistance, workshops, seminars, retreats, providing support for prevention activities, opportunities such as mentoring to support participation in activities and strategies. Fourth would be enhancing access and reducing barriers. So the increase, the ease and the ability and opportunity to use the systems and services, assuring healthcare, childcare, transportation, housing, and the list goes on. These can include identifying the barriers and possible strategies to overcome these specific issues. Changing consequences of behavior, creating incentives, public recognition, individual rewards, as well as disincentives, taxes, citations, fines, changing physical design, making environmental changes. And then lastly, modifying, changing, developing policies, right? Change written procedures, bylaws, proclamations, rules, or laws written documentation of voting procedures, public policy actions. So identifying really a comprehensive selection of evidence-based prevention strategies and interventions is really vital. And that's going to be key for effective community change. So this is really a problem-solving process that we have when we really have an issue that we see in the community, whether it's violence, whether it's education. We really just use these 7 strategies to really break it down. And it's really equally vital to implement each of these evidence-based strategies, so that way you get it in a more comprehensive manner, I guess you would say, as possible. So I hope that wasn't too complex, but I just wanted to kind of break that down. That's the only thing I could really think of, really trying to answer that question.
No, thank you. And I think, some of those items you had mentioned and some of the work that we do, it's these are very big questions we are asking, and kind of at least starting to break them down so they're a little bit more digestible is always a helpful starting point. And when they're really specific strategies like that, it's even more helpful. Thank you. And just to close out the last, just for the facilitated discussion piece, and then we'll move on to audience Q&A. What are your words of wisdom, caution, and hope to others who want to be more intentional about addressing systemic racism and poverty at the program level and through their organizations?
We got to engage the people. We got to engage the community. We got to engage the people. We have to meet them where they are, and really bring them in to see, because it's sometimes it's so much of a divide. Like we're on calls like this, and there's a lot of similarities within our different fields, and you see it, within our presentations on what, the services that we're providing. So I think really engaging the community, and through that, it really develops young people, young leaders, we need new faces. We have a lot of the same, no disrespect, we have a lot of the same elderly people that are in office, that are in these positions of power, that are in these seats of authority, but we need to develop young leaders to where, the advocacy can be at a sense of urgency. Because we could talk about it, we can implement a bunch of issues, but where's the action? Where is the push? Where is the accountability to hold our leaders accountable, and not just the old same traditional ways? So I think engaging the community, really having that community organizing, having that structure to where we know, which ways to go, which issues to address at the top of the list of a priority, and then really developing young people, new leaders. Not necessarily, it doesn't have necessarily be in adolescent, but just, younger than what we see, right? And then, just advocate with urgency. I think, we can talk, but it's really about these action steps, and even leaving calls like this, what's the next steps after this, and how are we networking with each other, whether we're, in different states and different cities, but how are we networking with each other to even give advice to each other in our different states and our different capacities of how we provide services. What areas of improvement can we go from here on out to address back in our respective programs, and what things we can take back to say, this is something that we may need to do better and we need to evaluate. So again, engage, develop, advocate. That's all. That's what I would say.
Thank you. Oh, Claudia, I think you're on mute.
I was saying that Eddie just described my job. That's what, that's what basically I do, community engagement. That's what I try to keep pushing through the community and see what else we can do. In fact, you just described what I always repeat over and over and over. And when we talk about the transition and exciting time for the city instead, but for me, it's super exciting, just because this is the opportunity just to do that change, to see that change. Don't have I always mention that we recycle people within government. So you might see the same people over and over in different positions and so forth. So for me, what the community engagement will do, a good community engagement will do, bring in the people that don't have a voice, but also bring the new population that, I represent the Latino community in one way, but I don't know everything about the Latino community. I know the community that is my generation, but I don't know the young generation. So they speak other language even. We speak English or Spanish or whatever it might be, but they speak sort of speak another language. So they're not at the table most of the time. But when we invite them to the table, which is my intent, we need to also kind of have for them enough support for them to thrive. Because, because sometimes you invite them, but they don't find enough support to thrive, it's no point just to go on that. It's a waste. So it takes, that's how I kind of see in my mind the community engagement. Bring new people, engaging them, make sure that they have enough support to thrive, because that would be the leadership that we need for the future generations. So if we don't prepare them, whoever them might be, we are really in a bad place. So how we can do that? That is always the goal that I have in my mind, how we can just to create that fire under people, just to come and participate. Let us know what you have in mind, how we can serve better the community, and how I will support you. That's my responsibility, how I will support you. So that is always in my mind, trying to figure out how we're going to move forward on this.
Thank you. And I think that's a good, to paraphrase, really the intent will be to engage, advocate, and activate in order to support, to thrive. And I would even add then to lead. Thrive and then lead. Okay. Moving on to some audience Q&A. Are there specific ways you would advise organizations and governments to address the lack of trust in organized programs and government services?
Say that again, please.
Yeah, I guess, are there specific ways you would advise organizations to address the lack of trust in kind of organized programs and government services?
Certainly. Obviously, the different communities, you have to, in my case, it's a little bit easier that probably for other people within my same organization, because I've been around, and that give me the advantage to know people. So, I mean, even if I'm a foreign born myself, I've been in this community for over 20 years, and I've been in the capacity of working in the trenches. So, and that is the people I go to. I see Eddie kind of smiling. So this is the people that I normally go to just to figure out what else I need to do. Being in a position that I need to learn from you. I need to know what I can do better for help the community to move forward. One of the things that we have here, for example, which really is interesting, because this is prior my times, when I start talking about Title VI, civil rights, 1964. So 20 years ago, people look at me like, what? What are you talking about? Why we need to do this? Why government need to have a language access resolution for? So when you start talking about the communities tells you. So for me to develop that trust, number one, you need to spend the time. And I believe I used the example before when I had the conversation with you, with some of the ladies here. Here we have a big Vietnamese community. It's the oldest community, refugee community we have in Louisville, Kentucky. The elders do not speak English at all. So they never participated in anything that we put in as events, like fun events or health events. They did not participate. It took my personal time really to go and visit them for months until they realized, hey, we might trust her. I don't speak Vietnamese, but I used to go to the Vietnamese mosque every Sunday, sit there until they decided that I was okay to talk to me. So since then, I spent that time, and I think that is the key thing. Spend the time with the people that you want to engage. For me, it's very difficult to do community engagement in front of the computer. I need to go and see the people. I need to spend the time with the people. That, for me, is the key. Be there for them, listening to what they say. I don't normally talk when I go there. I listen. Watch us stay there, whatever event that they might have. So for me, that is the key thing, just to develop the trust that you need just to engage people in any activity that you want for them to be in.
I can't say any better than what she did. I think it's very important. Again, going back to meeting them where they are, going back to, you know, holding yourself accountable. It's not just about, you know, because it just comes from experience, but I don't want to get too deep. But it's just more of, you know, the talkers. Really it's about action and sitting down, understanding. And like she said, it's about listening, right? Why are we sitting down at the table with folks and, you know, we're not listening? We have everything to say of why we can't do this, but what can we do to change that? And I'm really just more about solution based. I'm really just more about action. So there is a lot when it comes to trust, but when you really understand the people and understand the reasons why they are, you know, get to know more, build those relationships, and really come in with the heart that, you know, you really want to serve. Come with the heart that you're not just about talking, but you're really about solutions. And I think that's going to really help, you know, change this whole repeated cycle of why we don't trust, you know, those people in those positions of power. So again, I just think it's really developing those real relationships and understanding and allowing the people to help you through, right? If it's somebody that, you know, you want as a constituent to, you know, help you improve, I think it's essential that they're going to be the ones that really help you, you know, get to the next level. So I just think, you know, once they have your trust, once they know that you're, you know, you talking about it, you know, you walking it like you talking it, then I think it's a different approach versus, you know, we're just talking and seeing the same thing over and over again. And it's like, you know, why are we sitting down here again? Why are we having these conversations? You know, let's do something.
Yeah, and also would like to add, in when I talk to people, I always tell them that there is certain flexibility in anything that we do, because obviously in government it's a little tough just to talk about flexibility, but I'm trying to always kind of create the opportunity to think when, you know, when we have something going on, that there is a flexibility allowed there. So things can change. They're not set in stone. We might, if this doesn't work, we're gonna need to change that. And that is the best way also, just to develop trust. Not like if I said this is working and we're going to keep it that way, even if it doesn't work. So looking at the data that I might have collecting, I will figure out if it's not working, okay, we will change it. And how we're going to change it, we will see. But also, it is so vital to me, do not promise anything that you are not going to be able to provide.
There you go.
Yeah, if you don't know that, you know, not just because it looks good on paper or looks good to say it, you know, I am very, very careful on that. I don't promise anything that I'm not sure if I will be able to provide.
Reinforcing that credibility and legitimacy of those involved in those public decisions.
Absolutely.
Kind of relatedly, before moving on to the next question, in your experiences, what has been kind of helpful for getting those in positions of power, whether it's policymakers, funders, even folks in the government, you know, more admin or government officials? How have you been able to get them to be active listeners to those in your communities?
Oh, I mean, I'm gonna keep talking about the youth because this is what I do. So, meet us where we are. You know, we invite them to the table. We invite them to our summits. We invite them to our weekly meetings right here at the north end of Hartford, where the high end of rate of violence is. But our headquarters is right here in the city. And as she mentioned earlier, the trenches. But we have them come in. They come and listen, and they hear the youth voice. They hear the youth speak. And some of them are impressed. Some of them are shocked because they don't expect adolescents to be, you know, that knowledgeable of what's going on in their city, to have, you know, background on public policy information and know how to advocate and take those necessary steps to bring these to the lawmakers and say, look, we're tired of seeing this. You know, my friends are dying. You know, my family members are getting killed, and you know, my people are suffering in the education system. The schools supports are not doing X, Y, and Z. And so there's so many problems to where it's like, you know, we want to invite you to the table. If not, we want to be on that Zoom call. If not, we're going to show up to City Hall. If not, we're going to show up to the LOB when there's time. And, you know, it's just all about, you know, that public choice and that public decision to say, look, if y'all not going to meet us here, when we send you the invite, we're going to meet you where you are and really like express ourselves and let you know, like, this is what's going on and we need you to do something about it.
Yeah, in my case, I will describe it as still getting in trouble. Because I'm invested within the community for a long time. So I feel like somebody has to say stuff. And, so I ask the question all the time. And I go up. So if don't get the answer, I keep going up. And I keep going up. And I'm saying getting in trouble because sometimes they tell me, hey, you need to go through the proper channel. And I'll kind of go out of the proper channel sometimes. So, and knocking doors. I mean, I remember when we did the language resolution, you need to really talk to the representatives, the council people in my case, and make sure that they know their community. They have 25, we have 25 districts here. And they need to know what the community that they serve. So they might don't know, I'm here to help them on that. So we're gonna go and visit those particular communities that I'm talking about, the poor community, the one don't have enough daycares available. We have an area of town that we don't have a grocery store. So we're talking about food access. We have big food deserts in the city. So how they're gonna listen or see that reality? Well, I will keep knocking their doors and bring them or take them to places. That's to me the main thing. Right now, we are really lucky in a way. We have a young state representative in my district that he listens, and we started the conversation with him early on when he started campaigning. And after the elections, he said, hey, Claudia, we need to keep talking. We need to help me just to listen to the community. That to me is an example of representative. He called me. I didn't need to call him.
Thank you. Many organizations struggle with engaging meaningful community voice and co-creating with community. How would you advise organizations in moving forward with community engagement?
Really, I'm trying to say this in the most respectful way. Like at the end of the day, it's kind of like we all have the same mission and vision sometimes where, it's just that one purpose. Why can't we just come together? Why is it so much divide to where we have to, be separated in certain capacities? So I think it's really just understanding where the like-minded individuals are and getting us together in a larger force and a larger capacity as much as possible, because we can say, oh, we have this violence intervention program across town that's doing the same thing. We're seeing each other in the hospital. We're at these different conferences and at these different things, but we never we never connected. We never collaborated on anything. And it's just like, so I think it's just, once we put our pride to the side and come together and really want to be like-minded individuals, because it's power in number. So I think that's the most effective way to really get the divide broken, eradicate that divide, and come together as a community to really make change and see that difference. That's where I would at least start. That's where we have to start. But it's just too much. Sometimes it could be too much separation, too much separate opinions. But then at the end of the day, we're all out for that one purpose. And it's for changing in whatever specific capacity we're trying to do. So yeah.
Obviously the conversations with the different communities is vital, but in the last couple months, local governments are thinking about, hey, we always tell people to do stuff. You have to, you must do. So coming from the authority type of idea. So one of the things we've been thinking of is meeting people, as Eddie said, where they are in a different way. So let's look into another format. So what we come up with is to create an art project. The art project will be something is really in the early stages, but what I'm visioning through this is creating a single art project for the whole community. Not an easy task, but one of the partners that we use is the Kentucky Museum of Arts that is housed here in Louisville. So with their partnership, what we're trying to figure out is to create a single art project and with people from the community can come and work on, but with a single idea and how we're still thinking about the theme, but the theme basically will be something that unites us. Why in Louisville, why we think that we're gonna move this city forward for the future leader, for the children and so on. So with that in mind, through the art project, again, something kind of fun. It's, for us, in a way, is we said, hey, we need to provide something that people will enjoy more instead of us saying, you have to do that.
Mm-hmm.
So inviting everybody in different part of city. Here we are from kind of north, south, east end, and so on in the city. So having a project done in the different sessions in the different part of the city. And at the end, the artist that coordinates this effort will put the piece together. And that piece will come with a narrative probably in which the community will say to us how they see the city moving forward. So in a way, again, the chart was, let's do something different. So I thought through art, let's do something different with art involved, in which, you don't even need to speak. You need just to do. You need to engage your family, and it will be open for anybody, for all the family, young people, older people. So no matter the skills that you have, even a person like me has zero talent, artistically speaking, I can go and do something because I will be guided by an artist. So that is to us in this moment, what we think that will be probably more helping us in the progress of, or in the process of engaging the community more and more with us.
That's fabulous. And obviously, art has had a very important role in advocacy and policy work, I think, in the US and abroad. The final question we had in the chat from Jacob is, how would you suggest that PCAA take an active lead with promoting these recommendations? I feel like the most important piece is education. So how do we advocate to create a more inclusive history so that there is a foundational knowledge where we can all grow from?
But I think it starts right here. It starts with, this series. I haven't been attending the past 3, but just receiving the material and information and learning about the other agencies and what they have to offer and what they're doing in their respective places. I think that's more of an educational piece. And then I think, following this, how are we following up and how are we staying connected to learn how can we create, like he said, a more inclusive history, right? To really use different strengths and different things that PCAA may have that can benefit HCTC, what HCTC can do to, and vice versa, what Claudia's program can do to, help others. And, this is being captured, this is being recorded. So I think really just having these type of platforms, obviously, as we're still in this virtual world, but eventually, if we're all coming together and networking, having some type of annual events or quarterly events that we can continue to stay connected and continue to grow knowledge from each other, I think can benefit and help us educate ourselves. And yeah, at least that's a start.
Absolutely. These type of platforms are super helpful. Number one, because they give us the capability to interact with people all over the place. It doesn't have to be, I don't need to travel and talk to anybody. I just can be here and having representative, which I will be curious to figure out where the people is coming from. But, this is my reality in Louisville, Kentucky, that might probably mirrors, other cities in the nation. So that is amazing because I don't need to recreate a lot of stuff. Maybe if something worked for you, well, let's utilize that knowledge. This is the educational piece that I always look for. Right now, I belong to one group that is in LinkedIn, which I love. It's one time a week. And there is people from different states. And we talk about cultural competency, diversity, and equity. And it's amazing because, number one, give us the time to stop and kind of rethink what we're doing, number one. Also, just to bounce ideas with other people that are working in the same field that you are. So that to me is an amazing opportunity, an amazing piece of education, which I would love a lot of agencies could offer that. Because it's super helpful to kind of count on people that been there, already are, going through the process of what is the community, how we can improve this, how we can prevent, child abuse or whatever it might be. So to me, that pieces are amazing.
There's also another approach I just thought about that our youth leadership academy does in regards, when you want to collect data, of course, the first thing you go to is a web engine or Google search. But there's another approach that we have is called what the community has to say. And our youth leaders go into the community, whether they go into local businesses, we schedule meetings with policymakers just to hear them and interview them on the topics and root causes and local conditions of the issues that we're dealing with in our community, and seeing what they have to say. And this is how, it's recorded, and this is how they bring it back to actually use it as data and use it as information in their future presentations. Or how can we assess, well, this policymaker is saying this local business or this local resident is saying X, Y, and Z. These are the issues that are going on outside of what we're getting from the research and data that we've researched, but this is actually what the community has to say. And so we just, change it and putting it in that sense, similar to platforms like this. This is what the community, this is what the networks, this is what these different organizations and agencies that is doing this work, this is what we have to say. And that's being captured. So that's another sense of how to, educate yourself more on, that sense.
Very powerful. Well, seeing that there's no additional Q&A questions in the chat, we can wrap up a little early. And so I just wanted to thank you all for joining us today. We appreciate your questions, insight, and contributions to this work. And we'd like to give a special thank you to our panelists, Eddie Brown and Claudia Peralta-Mudd, for joining us and for their incredible work in their communities. As mentioned at the kind of top of this program series, this is the last Zooming Out for the calendar year, but we invite you to keep an eye out in the new year as we continue these important conversations. Happy holidays, and I hope to see you all at HFA Live starting tomorrow.
Thank you.
Thank you, everyone. Have a great one.
Bye-bye.